Linking on my brain. Okay. Linking on my brain. I got linking on my brain. Whoa.
Gluteal region. Introduction. The gluteal, Greek rxmp, region overlies the side and back of the pelvis, extending from the iliac crest above to the gluteal fold below. The lower part of the gluteal region, which presents a rounded bulge due to excessive amount of subcutaneous fat, is known as the buttock or natis. The anterosuperior part of the region seen in a side view is called the hip. The muscles, nerves, and vessels emerging from pelvis are covered by gluteus maximus and buttock. Morphologically, the erect posture of man has led to extension at the hip and appearance of gluteal fold, which is a transverse skin crease of the hip joint. This puts greater responsibility on gluteus maximus, which makes the body erect and maintains it in erect posture at the hip. This involves raising and supporting the trunk against gravity. The gluteus maximus, covering the hip joint, is, therefore, one of the most powerful and bulkiest muscles in man. Surface landmarks. 1. Buttock is the rounded bulge in the lower part of the gluteal region. The two buttocks are separated from each other in the posterior median line by the navel/cleft, which begins at the third sacral spine and deepens inferiorly. The gluteal fold marks the lower limit of the buttock. Note that the gluteal fold is the transverse skin crease of the hip joint and that it does not correspond to the lower border of gluteus maximus, which crosses the fold obliquely downwards and laterally. 2. Ischial Tuberculi is a large bony prominence which lies deep to the lower border of gluteus maximus, about 5 cm from the median plane and about the same distance above the gluteal fold. It can be felt by placing the fingers in the medial part of the gluteal fold and pressing them upwards. 3. Greater Trochanter of femur is a large bony prominence situated immediately in front of the hollow on the side of the hip and about a hand's breadth below the tubercle of iliac crest. 4. Iliac Cruciate is a thick curved bony ridge felt in a groove in the lower margin of the waist. The hands spanning the waist are often supported by the iliac crest. The highest point of iliac crest corresponds to the interval between the spines of the third and fourth lumbar vertebrae, site of lumbar puncture. The anterior end of iliac crest is known as the anterior superior iliac spine. A line drawn from here to the front of the greater trochanter marks the junction between gluteal region and the front of thigh. The posterior end of iliac crest is known as the posterior superior iliac spine. It lies in the floor of a dimple about 5 cm from the median plane and at the level of second sacral spine opposite the middle of sacroiliac joint. 5. Sacrum lies posteriorly between the two hip bones. The upper 3 sacral spines are usually palpable in the median plane. The second spine, lying between the two posterior superior iliac spines, is the guide to the other 2 spines. The lower part of sacrum and the coccyx lie in the floor of the natal cleft. 6. Coccyx lies just behind the anus. It is slightly mobile under pressure. 7. The sacrotuberous ligament lying deep to the lower border of gluteus maximus can be felt by a firm pressure between the lower part of sacrum and ischial tuberculi. Dissection: make a curved incision from spine of second sacral vertebra, I, along the iliac crest till its tubercle. 2. Make a vertical incision from the second sacral spine downwards till the natal cleft. 3. Taking it further laterally with downward convexity till the middle of the back of thigh. 4. 4 points v. 6, 7, 8, and 9 refer to chapters 6, 7, and 9. Reflect the thick skin and fascia towards the lateral aspect. The cutaneous nerves and vessels are difficult to find. Study them from the text. After removing the deep fascia from gluteus maximus muscle, define the attachments of this muscle. Superficial fascia. It is heavily laden with fat, more so in females, and is tough and stringy over the ischial tuberculi, where it forms an efficient cushion for supporting the body weight in the sitting posture. It contains cutaneous nerves, vessels, and lymphatics. Cutaneous nerves. The cutaneous nerves converge on the gluteal region from all directions. 1. The upper and anterior part is supplied by the lateral cutaneous branches of the subcostal T12 and iliohypogastric L1 nerves. 2. The upper and posterior part is supplied by the posterior primary rami of spinal nerves L1, L2, L3, and S1, S2, S3. 3. The lower and anterior part is supplied by branches from the posterior division of the lateral cutaneous nerve of the thigh, L2, L3. 4. The lower and posterior part is supplied by branches from the posterior cutaneous nerve of the thigh, S1, S2, S3, and the perforating cutaneous nerve, 52, S3. Cutaneous vessels and lymphatics. The blood supply of the skin and subcutaneous tissue is derived from perforating branches of the superior and inferior gluteal arteries. The lymphatics from the gluteal region drain into the lateral group of the superficial inguinal lymph nodes. Deep fascia. The deep fascia above and in front of the gluteus maximus, i.e. over the gluteus medius, is thick, dense, opaque and pearly white. Over the gluteus maximus, however, it is thin and transparent. The deep fascia splits and encloses the gluteus maximus muscle. Muscles of gluteal region dissection. Reflect the gluteus maximus to examine the underlying structures. For this, identify the lower border of muscle. Insert a forceps on the deep surface of muscle which is to be cut from below upwards midway between its origin and insertion along the course of posterior cutaneous nerve of thigh. Reflect 2 parts on either side. Piriformis is key muscle of the region, define its margins. Identify the structures above and below this muscle, most important being the sciatic nerve. Above piriformis are superior gluteal vessels and nerve. Below piriformis are inferior gluteal vessels and nerve. The thickest nerve of the body, sciatic nerve, also enters the gluteal region through the greater sciatic notch below piriformis muscle. Pudendal nerve and vessels appear here through greater sciatic notch and disappear through the lesser sciatic notch. Under the lower and medial part of the gluteus maximus muscle, ischial tuberculi is easily palpable. Separate the hamstring muscles from the ischial tuberculi. Identify long vertical sacrotuberous ligament and smaller horizontal sacrospinous ligament to demarcate the greater and lesser sciatic foramina and structures entering and leaving them. Greater sciatic notch is the gateway of the gluteal region. Define the borders of the gluteus medius muscle. Cut through the muscle 5 cm above its insertion into the greater trochanter of femur. The superior gluteal vessels and nerve are now exposed, which are to be traced into gluteus minimus and tensor fasciae lati. Reflect gluteus minimus from its origin towards the insertion to expose the straight and reflected heads of rectus femoris muscle and the capsule of the hip joint. Features. These muscles are the gluteus maximus, the gluteus medius, the gluteus minimus, the piriformis, the superior and inferior gemelli, the obturator internus, obturator externus, and quadratus femoris. The tensor fasciae lati, which lies on the lateral side of thigh, just in front of gluteal region, is also considered here. The attachments and nerve supply of these muscles are structures under cover of gluteus maximus. These are numerous as follows. Muscles. 1. Gluteus medius. 2. Gluteus minimus. 3. Reflected head of the rectus femoris. 4. Piriformis. Obturator internus with 2 gemelli. 6. Quadratus femoris. 7. Obturator externus. 8. Origin of the 4 hamstrings from the ischial tuberculi. 9. Insertion of the upper or pubic fibers of the adductor magnus, figs 5.5 and 5.6. Vessels. 1. Superior gluteal vessels. 2. Inferior gluteal vessels. 3. Internal pudendal vessels. 4. Ascending branch of the medial circumflex femoral artery. 5. Trochanteric Anastomosis, described with arteries of gluteal region. 6. Cruciate Anastomosis, described with arteries of gluteal region. 7. The first perforating artery. Nerves. 1. Superior gluteal, L4, L5, S1. 2. Inferior gluteal, L5, S1, S2. 3. Sciatic, L4, S5, SL, S2, S3. 4. Posterior cutaneous nerve of thigh, S1, S2, S3. 5. Nerve to the quadrats. S femoris, L4, L5, S1. 6. Pudendal nerve, S2, S3, S4. 7. Nerve to the obturator internus, L5, S1, S2. 8. Perforating cutaneous nerves, S2, S3. Bones and joints. Ilium. Ischium with ischial tuberculi. Upper and lower femur with greater trochanter. Sacrum and coccyx. Hip joint. Sacroiliac joint. Ligaments. 1. Sacrotuberous 2. 2. Sacrospinous. 33 Ischiofemoral bursae. 1. Trochanteric bursa of Gluteus maximus. 2. Bursa between the Gluteus maximus and vastus lateralis. 3. Bursa over the Ischial Tuberculi. Structures deep to the Gluteus medius. The Gluteus medius covers the superior gluteal nerve, the deep branch of the superior gluteal artery, the Gluteus minimus, the trochanteric bursa of the Gluteus medius. Structures deep to the Gluteus minimus. Structures lying deep to the Gluteus minimus include the reflected head of the rectus femoris, and the capsule of the hip joint. Testing Gluteus maximus. The patient lies prone. The right hand of physician presses the patient's right leg downwards. Patient is requested to extend his hip against resistance provided by the physician's right hand, while his left hand feels the contracting Gluteus maximus muscle. Then the Gluteus maximus is paralysed as in muscular dystrophy. The patient cannot stand up from a sitting posture without support. Such patients, while trying to stand up, rise gradually, supporting their hands first on legs and then on the thighs. They climb on themselves. In IRMPSCU for injection S are given in the anterosuperior quadrant of the gluteal region, i.e. in the glutei medius and minimus, to avoid injury to large vessels and nerves which pass through the lower part O1. This region. Gluteal region is not the prominence of the buttock only. It is a very big area over the iliac bone. When the glutei medius and minimus, of right side, are paralysed, the patient cannot walk normally. He bends or waddles on the right side or paralysed side to clear the opposite foot, i.e. left, off the ground. This is known as lurching gait. When bilateral, it is called waddling gait. The normal gait depends on the proper abductor mechanism at both hips. This mechanism comprises the adequate power provided by the glutei medius and minimus. The fulcrum, formed by a normal relationship of the head of the femur with the acetabulum. The weight transmitted by the head and neck of the femur. Normally when the body weight is supported on one limb, the glutei of the supported side raise the opposite and unsupported side of the pelvis. However, if the abductor mechanism is defective, the unsupported side of the pelvis drops, and this is known as a positive Trendelenbutz sign. The sign is positive in defects of power, i.e. paralysis of the glutei medius and minimus, defects of the fulcrum, i.e. congenital or pathological dislocation of the hip, and defects of the weight, i.e. ununited fracture of the neck of the femur. Gluteus medius and gluteus minimus can be tested together by doing internal rotation of thigh against resistance. The person is in supine position with the hip and knee flexed. Gluteus medius, gluteus minimus, and tensor fasciae lati are tested by the abducting lower limb against resistance. The person in the supine position and the knee is extended. Sacrotuberous and sacrospinous ligaments. These two ligaments convert the greater and lesser sciatic notches of the hip bone into foramina of the same name. The sacrotuberous ligament is a long and strong ligament extending between the medial margin of ischial tuberculi and the posterior iliac spines. It forms the posterolateral boundary of the outlet of the pelvis, Fig. 5.14. The sacrospinous ligament is a short, thick, triangular band situated deep to the sacrotuberous ligament. It is attached, laterally to the ischial spine. Medially to the sacrococcygeal junction. Nerves of the gluteal region: superior gluteal nerve, L4, L5, SI. The superior gluteal nerve is a branch of the lumbosacral plexus. It enters the gluteal region through the greater sciatic foramen, above the piriformis, runs forwards between the gluteus medius and minimus, and supplies three muscles, viz., the gluteus medius, the gluteus minimus and the tensor fasciae lati. Inferior gluteal nerve, LS, SI, S2. This is also a branch of the sacral plexus given off in the pelvis. It enters the gluteal region through the greater sciatic foramen below the piriformis, and ends by supplying the gluteus maximus only, to which it is fully committed. Sciatic nerve, L4, L5, SI, S2, S3. Course. This is the thickest nerve in the body. It is the main continuation of the sacral plexus. It enters the gluteal region through the greater sciatic foramen below the piriformis, runs downwards between the greater trochanter and the ischial tuberculi, and enters the back of the thigh at the lower border of the gluteus maximus. It does not give any branches in the gluteal region. Cal ana sciatic nerve block is done by injecting an anesthetic agent few cm below the midpoint of the line joining posterior superior iliac spine and upper border of greater trochanter. Piriformis syndrome occurs if sciatic nerve gets compressed by piriformis muscle. It leads to pain in the buttock. Posterior cutaneous nerve of the thigh, SI, S2, S3. It is a branch of the sacral plexus. It enters the gluteal region through the greater sciatic foramen, below the piriformis, and runs downwards medial or posterior to the sciatic nerve. It continues in the back of the thigh immediately deep to the deep fascia. The nerve gives a perineal branch which crosses the ischial tuberculi, enters the urogenital triangle of the perineum, and supplies the skin of the posterior 2/3 of the scrotum, or labium majus. Gluteal branches which wind upwards round the lower border of the gluteus maximus, and supply the skin of the postero-inferior quadrant of the gluteal region. Nerve to quadratus femoris, L4, L5, S/. This nerve arises from the sacral plexus, enters the gluteal region through the greater sciatic foramen below the piriformis, and runs downwards deep to the sciatic nerve, the obturator internus and the gemelli. It supplies the quadratus femoris, the gemellus inferior and the hip joint. Pudendal nerve, S2, S3, S4. This is a branch of the sacral plexus. Only a small part of this nerve is seen in the gluteal region. It enters this region through the greater sciatic foramen. It then crosses the apex or lateral end of the sacrospinous ligament, medial to the internal pudendal vessels. It leaves the gluteal region by passing into the lesser sciatic foramen through which it enters the ischio-anal fossa. Nerve to the obturator internus, LS, S1, S2. This is a branch of the sacral plexus. It enters the gluteal region through the greater sciatic foramen and crosses the ischial spine, lateral to the internal pudendal vessels, to re-enter the pelvis. It supplies both the obturator internus and the gemellus superior muscles. Perforating cutaneous nerve, S2, S3. This is a branch of the sacral plexus. It pierces the lower part of the sacrotuberous ligament, winds round the lower border of the gluteus maximus, and supplies the skin of the postero-inferior quadrant of the gluteal region. Arteries of gluteal region. Superior gluteal artery. It is a branch of the posterior division of the internal iliac artery. Course and distribution. It enters the gluteal region through the greater sciatic foramen passing above the piriformis along with the superior gluteal nerve. In the foramen, it divides into superficial and deep branches. The superficial branch supplies the gluteus maximus. The deep branch subdivides into superior and inferior branches, which run along the anterior and inferior gluteal lines respectively, between the gluteus medius and the gluteus minimus. The superior division ends at the anterior superior iliac spine by anastomosing with the ascending branch of the lateral circumflex femoral artery. The inferior division takes part in the Trochanteric Anastomosis. Inferior gluteal artery. It is a branch of the anterior division of the internal iliac artery. Course and distribution. It enters the gluteal region by passing through the greater sciatic foramen, below the piriformis, along with the inferior gluteal nerve. It supplies, 1 muscular branches to gluteus maximus and to all the muscles deep to it below the piriformis. 2 H0s branches to the buttock and the back of the thigh. 3 An articular branch to the hip joint. 3 A cruciate anastomatic branch. 4 An artery to the sciatic nerve, which represents the axis artery in this region, and may at times be quite large. 5 A coccygeal branch which supplies the area over the coccyx. 6 Internal pudendal artery. This is a branch of the anterior division of the internal iliac artery. It enters the gluteal region through the greater sciatic foramen. It has a very short course in the gluteal region. It crosses the ischial spine and leaves the gluteal region by passing into the lesser sciatic foramen through which it reaches the ischio-anal fossa. Trochanteric Anastomosis. This is situated near the trochanteric fossa, and supplies branches to the head of the femur. It is shown in flow chart 5.1. Cruciate Anastomosis. This anastomosis is situated over the upper part of the back of the femur at the level of the middle of the lesser trochanter. It is shown in flow chart 5.2. Structures passing through the greater sciatic foramen, gateway of gluteal region. 1 The piriformis, emerging from the pelvis, fills the foramen almost completely. It is the key muscle of the region. 2 Structures passing above the piriformis are, 3 Superior gluteal nerve. Superior gluteal vessels. 4 Structures passing below the piriformis are, inferior gluteal nerve. Inferior gluteal vessels. Sciatic nerve. Posterior cutaneous nerve of thigh. Nerve to quadratus femoris. Pudendal nerve. G. Internal pudendal vessels. H. Nerve to obturator internus. The last 3 structures, after a short course in the gluteal region, enter the lesser sciatic foramen, where the pudendal nerve and internal pudendal vessels run in the pudendal canal. Structures passing through th lesser sciatic foramen. 1 Tendon of obturator internus. 2 Pudendal nerve. 3 Internal pudendal vessels. 4 Nerve to obturator internus. The upper and lower parts of the foramen are filled up by the origins of the 2 gemelli muscles. Gluteus maximus is the anti-gravity, postural thickest muscle of the body. It contains red fibers. Sciatic nerve is the thickest nerve of the body. Intramuscular injections are given in the upper and lateral quadrant of the gluteal region. Greater sciatic notch is the gateway of the gluteal region. Sciatic nerve and pudendal nerve do not supply any structure in the gluteal region. Piriformis is the key muscles of the gluteal region. Sciatic nerve and its branches supply the hamstring muscles, muscles of all the 3 compartments of the leg and the muscles of the sole. Sciatic nerve is accompanied by a thin artery, the sciatic artery, which is part of the axial artery of the lower limb. Lesser sciatic foramen is the gateway of the perineal region. Sciatic nerve lies on the femur for a very short distance between lower border of quadratus femoris and upper border of adductor magnus muscles. At this site it may get compressed when one sits on a stool or a bench, leading to harmless condition, the sleeping foot.